Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And for today's tip of the week, I'd like to discuss how many staff do you need? Now, in dentistry, oftentimes we get caught up in expenses. How much am I spending on cotton rolls or impression material, or what's my lab fee to make a crown? And something to think about is, what is your staff salary on a weekly and monthly basis? And I've talked to some doctors who are very thrifty. They have no staff. I usually run into 1 or 2 doctors a year that practice by themselves. And they are very thrifty. They have an overhead of about 30%. Now, I can also look at that doctor and tell him he's only doing about 15, maybe at the most $20,000 a month, because he has to do all the work himself. And it's actually, in my opinion, not very productive and profitable for the dentist, who can be back in the back producing hundreds of dollars an hour, to be filing insurance. Now again, there's no pat answer here. It's a personal thing. So we have to dial this question back and take a look at, what are your goals? Are your goals to just maintain and not go backwards? Or are your goals to expand? If your goals are to expand, then you're going to have to add staff. Just as a quick example, take a look at how many new patients you get in a month. Let's say it's 25. That's 300 new patients a year. Over the span of 5 years, that's 1,500 patients. If you haven't added 3 or 4 or 5 days of hygiene over that period of time, I'd be concerned. I talked to some doctors who are very proud. One doctor once said, "The new girl has been there for 20 years. Well, I know immediately that that practice is not expanding. Now, you can look at the cost side of staff, but I think as business owners, we should be focusing on lost production. As executives, we should be putting pressure down on the organization to service more patients, provide more products, help more people keep their teeth, and the overall office production goes up. So rather than focusing on staff cost, I think you should be focusing on lost production. Now, this means you're going to have to hire. Well, obviously, there's a right way to hire and a wrong way to hire. At MGE, we have a 3-day seminar just on hiring. You also have to hire staff that move fast, they are willing to work, and they're not happy when there are no patients in the office. That would be a highly productive staff. And believe me, a highly productive staff is very profitable for the office, because you get a lot more production from each staff member. So this is something that I want you to consider. Consider expansion. The practice should be expanding every year, and that means you should be adding at least 1 day of hygiene every year. You might have to be adding an assistant every couple of years. Should be time to look for an associate for at least 1 or 2 days a week. And if you're nervous about that and you don't know exactly how to hire the right people, give me a call at MGE. And that's my tip of the week.